Just going to start over with this bullet point here. If caregivers live in an area that relies on well water, they're going to want to make sure they're monitoring the nitrate content of that water. Nitrate can cause hypoxia, which is low oxygen levels due to the compounds that produce that can't bind with oxygen. Interestingly, though, breastfed babies whose mothers drink well water are not at risk. It's just when that is used to prepare formula. Interesting. So the feeding technique, we should expect some spit up. Babies should be placed on their back or in a cradle position um, when they're being fed a bottle. Their head propped up slightly, like this guy is doing with this baby. The baby bottle should not be propped. Again, that can lead to that baby bottle tooth decay because they could fall asleep. When babies need to go to bed, they should be placed on their back to decrease their risk of SIDS. Um, However, that can lead to plagiocephaly, which is that flatter head. So we're just going to want to make sure that we're, allowing the child some movement with their head. Burp about every 10 minutes and monitor for signs of satiety, like swatting at the bottle, turning their head, blowing bubbles, things like that. Health problems related to infant nutrition. We see insufficient iron in the diet, entire food group absent from the diet, drinking raw milk, drinking goat's milk. Goat's milk does not have the same nutrient balance as regular milk. It is low in folic acid and B12. It is okay for babies after age 12 to have goat's milk. That baby should be offered a cup at around 6 months. Obviously, a cup that has a lid on it to prevent spilling. But if the child is not drinking from a cup by age 1, then that is cause for concern. If the child is still using a bottle past 18 months of age, that can be a concern. So they can still be drinking breast milk from the breast. They could still be drinking breast milk in a cup, but we want to get them off that bottle before 18 months. If the child is eating too much, over 100% of the nutrient standards, and if they're drinking large amounts of juice after 6 months, or really any sweetened beverage. Let's talk about colic. When we think of colic, it's a fussy baby. I want you to think of the rule of threes. Typically starts at about 3 weeks of age. The child is crying or unconsolable for over 3 hours a day, at least 3 times a week, and it lasts more than 3 weeks. Okay. It affects about 10 to 30% of all infants. Sometimes there's no physical problem identified with the baby. Maybe soothed, but rhythmic sounds or movements, change in formula may be warranted, or talk to mom about some foods that might be necessary to avoid if breastfeeding, like our real gassy vegetables like cauliflower, broccoli, onions, garlic, things like that. Um, Hopefully it goes away within a few months, but um, you can imagine this repeated crying spell for 3 hours. It's very frustrating for parents and heartbreaking for parents. So they're desperate really to try anything to get their baby feeling better. Other problems would be diarrhea, numerous loose stools in a day. They're at risk for dehydration here. They might want to switch soy to a soy-based formula. We want to encourage continuation of breastfeeding if they're doing that. But if the baby's eating solid food, the parent may try a brat diet, which is banana, rice, applesauce, and toast. So just real mild foods to help settle their stomach. With a milk allergy, that cow's milk contains about 40 different proteins that can cause an allergic reaction. So again, if baby is infant formula fed, then you'll want to switch to a soy-based or pre-digested protein formula. Maybe mom limiting the cow's milk in her diet could help as well. In older infants that are consuming too few solid foods, we can see the start of iron deficiency anemia. We want to make sure they're getting iron fortified formula, or if they're breastfed, that they're iron fortified cereals and meats. And then, based on a recommendation from their healthcare